Senator Brown.
Thank you, Mr. Chairman. Ms. Brand, I know that you, as a native of Ohio, understand how hard this epidemic's hit our state. 11 people died on Tuesday, 11 people died yesterday, 11 people will die today, 11 people will die tomorrow on the average, as you know. 11 isn't the only number that matters. Let me give you another number, 10,769. According to the American Academy of Pediatrics, that's how many Ohio children were placed in foster care in 2016. Many of them, not all, many of them a direct result of addiction, of this addiction epidemic. As you know, the Bipartisan Family First Act, just signed into law, requires the department to issue guidelines on program criteria and provide a list of preventive services authorized under Title 4E by October 1st of this year. I understand, since I'm way down in the list today because of the Banking Committee, I understand Senator Menendez asked earlier about implementation of Family First. I'm pleased to hear you all expect the guidance of states will come out in a timely manner later this year. Thank you to both of you for that. And thanks for your commitment on that. I have a few additional questions I'll submit for the record on the implementation of Family First, but I encourage you to solicit input and feedback. I know I don't need to admonish you to do that from the states as you move forward with this guidance. Before I get to my really only question, Ms. Brandt, and I'd like to just share some of the things Ohio's doing. We don't do well on infant mortality compared to other states. We don't do well in education. We unfortunately lead the nation almost in for-profit charter schools abuse, but we're doing some really innovative things on babies and neonatal abstinence syndrome. I want to talk for a moment about them. Every 25 minutes, a baby is born suffering from opioid withdrawal in this country. 2,100 babies, 6 babies a day were admitted to a hospital in Ohio for NAS. Just a decade earlier, just 300 cases were reported nationwide. So the explosion of numbers you two are all too familiar with. Ohio's doing a lot of creative things. Cincinnati Children's established a universal screening program that's helped to identify babies born with NAS and get them to treatment faster. In previous Finance Committee hearings, Senator Portman and I have talked about our work on the CRIB Act, which would help pediatric recovery centers receive reimbursement through Medicaid. Secretary Azar made the trip to Kettering, Ohio. I thank all of you for that, to see firsthand the work happening in our first pediatric recovery center, Bridges Path. I want to continue our work together to pass the CRIB Act to make sure that these recovery centers have the funding necessary. Another initiative that our state's been working on is through the Ohio Perinatal Quality Collaborative NAS project, which has developed best practices for treating babies born with NAS. Other states are looking to adopt this successful model. But our providers are overwhelmed, as you know. I hosted a conference yesterday for CEOs from a handful of Ohio's smaller and rural hospitals. They spoke about NAS babies, how hard they are for hospitals to treat. Not all of them have NICUs. Some of these smaller hospitals do not have providers who are experienced or specialized enough to care for these babies. As a result, they transfer these high-need infants to other facilities with more resources that are already themselves overwhelmed. But they realize the system isn't sustainable. One of the CEOs of these 100, 200-bed hospitals, smaller than that even, shared hospitals collaborating with another larger system to utilize telehealth technology to keep babies closer to home while they undergo treatment. The larger system will share their resources and expertise through that technology when babies are born with NAS at the smaller hospital. Their hope is to reduce burden on the regional hospitals that currently are caring for those babies. They anticipate a savings, obviously, from cutting back on transfer costs. Now, my question to you is, my request is, Ms. Brandt, talk to me about what CMS is doing to help NAS babies and improve care for moms and babies suffering from the addiction epidemic. What tools do you have to improve care options for these individuals? How does Congress support additional federal initiatives in that space through multi-state demonstrations? And then if you would answer that and then commit to working, if you would give us specifically on the record a commitment to work with us on these innovative solutions. So thank you.
Well, thank you for the question. I absolutely recognize the issues back home in my home state of Ohio. The county I'm from back home is one of the hardest hit, and it's a really big issue. And at CMS, we have been particularly focused on the issues you're talking about in terms of helping mothers and infants struggle with their opioid addiction. We've heard a lot about it. The secretary spoke very much about his visit at Bridges Path and what he learned in Ohio. So one of the things that we have done is in February of this year, we approved a state plan amendment for West Virginia, which we hope will be a model for other states to use. It's going to provide additional treatment services for neonatal abstinence syndrome in NAS treatment centers. It basically allows West Virginia to reimburse all medically necessary NAS services through an all-inclusive bundled cost, sorry, my voice is going out, bundled cost per diem rate based on a prospective payment methodology. This is a big shift from how we normally would reimburse for these services and allow more services to get covered. Some of the services that they can fund through this would now include nursing salaries, supportive counseling, and case management, which are currently not included. What it does not include, and this is part of what Congress could potentially take action on, are room and board costs and physician treatment services. Another thing that we've heard, and that was something that was raised when the secretary was at Bridges Path, is the limitation on 60 days of coverage for mothers who are postpartum and the fact that they don't receive services beyond that. So that's another thing that we've been looking at CMS, and we've heard a lot of feedback on, and would love to work with you all, not only on that issue, but on all of these issues, because we think they're critically important.
I spoke at the Cleveland City Club the other day about opioids and our government looking at it in a big, comprehensive public health way. And I used a couple of examples of when government, and a lot of people here don't think there is a role for the federal government in a lot of healthcare issues, when many of us on this side at least believe there is. But I use the example of tobacco in 1964, when the U.S. When the U.S. Surgeon General, I guess, first came out against, first recognized tobacco's public health crisis. 45% of American adults smoked. Last year, it was down to 15. You can look at how we treated the HIV/AIDS, and at the beginning, we had a president and a bunch of politicians that would not, and many others that wouldn't acknowledge it. Yesterday, my wife writes a weekly newspaper column that's syndicated, and she wrote about how Barbara Bush, whatever year she did this, when people were so afraid of HIV, you wouldn't even want to touch anybody with it, even though there was no evidence at all that it was transmissible that way. Barbara Bush went into a clinic and held a baby that was HIV positive. And then once we decided that, what we've been able to do in that public health arena, so we know how to do this as a country. This one looks more intractable maybe than the other ones. Maybe it is, maybe it isn't. But we know how to do these things when we really put our minds to solving a public health crisis. So you two are really on the front lines of that, and your whole careers have been dedicated to that kind of fight. So thank you both.
Well said, Senator Brown. Senator Casey.